What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Sex in the West, we tend to think of it as something dirty, but it's very necessary for health, for activating our rest and digest portion of our nervous system, the parasympathetic nervous system. So I brought in an expert, Dr. Elliot Justin, MD.
While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body Podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
Welcome to the show, Dr. Justin.
It's great to be here, and it is really important. I mean, if a man has sex every day, his cortisol levels can drop by half. If a man over 70, if they have sex twice a week, they can, versus twice a month, they can cut the cardiovascular risk by 50%. And the statistic that I really like is if couples that have sex twice a week versus twice a month, cut their divorce rate by 50%. So it's really important for people's physical health and for their mental health.
Yeah, you get that oxytocin release, right? Which is important for social bonding and parasympathetic tone. But one thing I wanted to kind of start out with is a lot of times we just assume, okay, you're not having erections, whether it's, nocturnal penile tumescence, or just you can't perform when it's time to have intercourse. We think low testosterone. But you and I were talking before we started recording, and it can be an indirect marker or direct marker for cardiovascular issues, correct?
That's right. I was actually unaware of that 3 years ago, as we discussed, earlier. My background, I'm an emergency medicine doctor and a medical technologist. And as an emergency medicine doctor, I can assure you that short of a heart attack or a stroke, nothing alarms a man as much as a limp dick. So, and we live in this age of healthcare wearables that can give you all sorts of important information about your health, but sex is a gap, and we're involved in filling that gap. So I was unaware of the significance of nocturnals. I didn't realize that a healthy man has 3 to 5 per night. It's not just enough to have morning wood. That's not enough. A man should have more than them. And that the number of nocturnals is a leading indicator of cardiovascular health. And as you know, as doctors, a leading indicator is a really powerful thing to say in medicine. In medicine, we treat associations. High blood pressure is associated with heart attack, stroke, kidney failure, but doesn't necessarily cause it. Or nor does it predict it. If your blood pressure goes from 130 baseline systolic to 160, doesn't mean you're gonna have a heart attack or a stroke. But if your number of nocturnals goes down from 5 to 2 or 3 to 0, you will have highly likely to have a heart attack or a stroke in the next 2 to 3 years. And one thing that's took me aback at FirmTech is that we've had 2 men that I'm aware of get cardiac catheterizations as a result of keeping track of the nocturnals. But we do more than that. We also measure what's going on when men are having sex. So with data, men can actually assess the impact of diseases, diabetes, hypertension upon their sexual performance. They can measure the impact of medications, with the big cocktails, if you will, being antihypertensives that are commonly prescribed. Like almost half the adult population with high blood pressure. And then the SSRI antidepressants, which are taken by about 18 to 20% of the population, which are also killers of erections. And there are other medications as well. And doctors never will warn people about the sexual side effects of medications. Or take sexual histories. Tim, I'll ask you, My experience has been I've never had a doctor discuss the sexual side effects of medication. I've never had a doctor ask about my sexual health or the status of my marriage. So here are these things that are critically important to our holistically to our cardiovascular health, our mental health, and our pretty much every system in our body is impacted, and the doctors don't even ask about these things.
Right.
What about you?
Yeah.
Anyone ever ask you?
Well, so because I'm in the functional medicine arena, yes, I hear about it all the
Okay.
time. But I'll tell you, about 4 years ago, I was having a conversation with a conventional urologist, and I was telling him about the association between lack of, nocturnal erections and cardiovascular risk. And he said, I don't know if that's true. And I said, PubMed, PubMed, my friend.
Yeah.
Um,
Well,
you know,
the
it's
penis, the penis is the canary in the coal mine of cardiovascular disease.
yeah. Absolutely. So tell us about Firm Tech, like what the devices are and what led you to develop them.
Sure. Well, about 3 years ago, I was contacted by a professor of urology at the University of Utah who wanted to count the number of nocturnal erections that men have. And my reaction was, I'm sorry if I curse, I'm from New York City originally. It's like, what the fuck for? Why do we care? We all know about morning wood and we laugh about it. And he explained to me and showed me that there are really well-written papers showing that the number of nocturnal erections is the leading indicator of cardiovascular health, but they're hard to document. So at that time, the only device to document them, and that device has fallen out of favor, is called Radioscan. And it looks like something Dr. Frankenstein would put in your penis. You have to basically sleep stiff in a supine position. You can't move because you got wires attached to a machine. It's not user friendly, and it doesn't reproduce real life situations, and it can't be used during sex. So when he told me about this, I thought, well, that's amazing because this would be like a sixth vital sign. And what would be more motivating to men to get healthy than their sexual performance? I mean, men, we live in this age of healthcare wearables. We've got smart watches, smart rings, but what do men care more about? I know I care more about my erections than I do about how many steps I took yesterday, or how many calories I ate yesterday, or what
Right. Yeah.
So, and so we had to reinvent the cock ring because cock rings are these hard silicone gaskets or nooses for your penis. And who wants to put a noose on their penis? They've never caught on. They can't be worn for more than 20, 30 minutes. They compromise circulation. In order for them to be effective, you have to have a full erection. Then essentially you put the ring on. It's like a chokehold on your penis. Now, 90% of gay men use cock rings regularly, and only 10% of straight men do. And so one of the challenges we faced was we had to reinvent the ring. So our rings are made out of soft elastomer. They're comfortable. They're stretchy. Silicone is a tough material. It makes you adapt to it. Elastomers adapt to you. So our cock rings don't block the arterial flow. They let the blood in, which we need as men. They only constrain the venous return. Imagine the drain that's like, 85% plugged, but it still can let the blood out. So we don't want to choke off the penis. So our rings can be worn for hours. And that's really beneficial too, because one, we can collect data overnight, or if men want to use our rings during sex to get their data while they're having sex. I don't know about you, but I like to have sex more than 20, 30 minutes. And I'd like to have sex that's comfortable. I don't want to have a ring that I want to tear off right away. So it's not a climax. So we are doing several things for men and their healthcare providers and physicians like you who want data. You want your healthcare to be data driven. One, we're giving men, telling men how hard they are and how long they last, so that men can then measure the impact of, diseases, medications, supplements, exercise upon their sexual performance, and men can now become an N of one. And this is something that's really important to the integrative community and should be more important to the conventional medical community, because we stupidly treat everyone as if they're one size fits all. Whether you're male, if you and I went to a doctor, conventional doctor, Tim, and said, "Hey, gee, when I exercise, my pulse goes to like 170 and it's irregular. It's alarming to me. I feel like I'm going to pass out." And that doctor just put their finger over our radial artery and said, "Hey, Tim and Elliot, take this pill called digoxin, come back in 3 months." We would think, what the fuck is this, 1900? I want a CT angiogram, I want an electrocardiogram, I want a monitor, I want my lipoproteins, in your world, you want to know inflammatory markers. There are so many things that you would want to measure. But in the conventional urology, sexology, internal medicine, primary care world, take this PD5 medication, Viagra or Alice, and come back in 3 months is what they do. And that is stupid. This is the 21st century, and we should be delivering data-driven personal care to people. The other thing we do, aside from data, is, the doctor who came to me with this idea, like most doctors, is a cock ring virgin. I'm fortunate she's here in the room right now. My wife and I went to sex toys. We would buy a cock ring once or twice a year, and they suck. They're novelties. You put them on, they're uncomfortable. You get rid of them. But I was certainly aware of them. So my thought was, having come up with a way of counting data with a cock ring that can be worn for a longer period of time, let's also invent a cock ring that will give men more pleasure, and men are more confidence. Because as men get older, we don't hold our erections as long as possible, even for someone as fit as you, Dr. Tim. I mean, I'm 71 years old. I don't know how you are, but when you're 13, 14 years old, you hold a girl's hand, you have a hard on for like an hour and a half. And because you've got really strong, aside from this, with minimal stimulation, you've got really strong, smooth muscles and really strong, small veins that are holding the blood in the penis. That's not the case at my age. So to come up, we have a ring we call the maximum performance ring. It does not have the technology. And that ring was designed to keep men comfortably hard for an hour, 2 hours. And that is a game changer for most men, not younger men as well as older men, because it addresses the confidence issue. Younger men lose erections because they get performance anxiety. And once a man is worried about his erection, this applies to older men as well too, it's harder to sustain an erection. You start, am I losing it? So to have a ring that will keep the blood in the penis, and it's more effective than PD5 medication, is a game changer for people's sexual relationships and their happiness.
And the name of that one is, what did you say?
We call it the Max PR, the maximum performance ring.
Okay.
You can achieve the same effect with a tech ring by tightening it, but the maximum performance ring, just you put it on, it's tighter. Personally, we make love. As people get older, we got a rush to orgasm. This applies to younger people too, who are anxious about their performance. If a man knows he's gonna comfortably keep an erection with minimal stimulation for 30, 40, 50, 60 minutes, that changes things. Now the relationship can become more intimate, less pressured, and this ring as well, the maximum performance ring, that one here. This ring we tested on 21 men, and age 27 to 70, I was the oldest man. And the goal was to increase the ejaculatory phase by 50% in that entire group of medicine. And then we would make the ring with that degree of elasticity. Well, I don't have sex without a ring. I never used a ring regularly before because my feeling was, well, I don't need it. And they hurt, they're uncomfortable. And now it's really a question of, I challenge men, the issue is one of one. Do you want to rock harder, longer, have a more intense orgasm? Because my orgasm with the maximum performance ring goes from 4 seconds to 7 seconds. Well, why would I not want to use it? And my wife's idea of foreplay is like dropping in front of me because I'm a guy, I'm easy. And she would like it too because for the same reason. She's commented several times. She's glad the kids are out of the house because I'm noisy for the first time. I never was before.
That's awesome. And so you got the maximum performance ring. The first ring was not the cock ring, but
the tech ring is the one that has technology in it. Although it's a good cock ring. The maximum performance ring is a superb cock ring. And then we just have the plain performance ring, which is for men who are larger or think they're larger. So we actually have on the website a calculator so guys can see where they are. And we recommend the performance ring for guys in 95th percentile. But we have men who are buying it who are not. they just hey, I'm big. Yeah. One of the jokes we have in the company, which we use at doctor shows, like American Urology Association. is how do you tell the difference between a gay doctor and a straight doctor with one question? Do you use a cock ring? Gay doctor, last night. Those guys have sex a lot. Last night, do you have a better one? Straight doctor. Oh, it's like Superman kryptonite. Oh, I don't need that. It's not about need. It's about want. Do you want to learn life-saving data, especially over the age of 45 or 50? Do you want data that's predictive of your cardiovascular health and can tell you about the impact of medications upon your sexual health? Do you want to last longer, more intense orgasm? I'm sorry. Let me turn this off. Sorry about that. And the answer, of course, should be yes. All guys want to have a longer life of lovemaking with data, and all guys want to perform better.
Absolutely. Let's talk about, so in the past, 3-4 years, the Clearly scan has become pretty popular, at least in integrative medicine, and obviously insurance doesn't cover it. But using that in conjunction with your tech, you see synergy there.
I'm not familiar with the Clearly scan, so educate me.
So it's basically, I haven't had one yet. It's a CT angiogram with AI. And supposedly, from what integrative cardiologists tell me, it's the most accurate test we have for cardiovascular disease risk, but also looking at.
I just think about it as CT angiogram with calcium scores. What I think about, it's the same thing. And now they have an enormous database. It's valuable, and I think every man over the age of certainly 50, should get it. We've not correlated that with what we're doing. And obviously, our technology doesn't require. It can be done in privacy at home. It's
Right.
And we actually there is some talk among the academic urologists on our scientific advice report about our device not only replacing a Doppler in office by a urologist, but actually being like a poor man's CT angiogram, because the two organs in the body that are most sensitive to sclerotic changes are the retina and the penis. And so before you see one of the issues with CT angiograms, what I'm aware of with them, you might know more about than I do, CT angiograms, is that they don't really get the microvascular in the.
Sorry, you froze for a minute there. What was the last thing you said?
I'm sorry. The question with CT angiograms is, how far downstream do they go into the arterioles, the really small vessels in the heart? And we don't know. So the hope is that with AI and an enormous database, we actually can start to do that. And I don't know whether that's the case. With retinograms, we actually can see arterioles and venules in the retina. Now, they're not the at-home retinograms are not that accurate. You really have to. You need at this point to get a retinogram with that degree of accuracy. You need to see an ophthalmologist. You can't see your optometrist, optician in order to get those really high-end retinograms. And although that will happen in our lifetime, Tim, that's going to happen in the next 5 years. You will be able to get a retinogram at home that will not only tell you about your retina, it's going to tell you about your microvasculature. We are adding, the device that we're selling right now is not what we're going to be selling a year from now, because technology is iterative, just the way AI is transforming CT angiograms. We're adding 2 sensors that we're testing right now that we will sell it. We will be adding to our device a year from now, maybe a year and a quarter, but certainly probably a year from now. But they're all going to make our device even more sensitive and specific. So I'd be very interested if you're using one. Are you going to be acquiring a machine for your office?
No, so I'm all virtual, but I plan on having one just for my personal self, just for knowledge, and then doing a video on it to create some content and education around it, and then kind of tracking my progress, so to speak. I do fairly high doses of omega-3s. I do a small dose of niacin because, as you know, with niacin, so my lipoprotein A, my last blood test was a little elevated. And so niacin, Dr. Mark Houston at Vanderbilt, who's the head of the Hypertension Institute, he likes niacin. But my HbA1c went way up. It was like 5.3, that went to 6.0, but I was doing 1 gram TID. So now I'm down to 500 milligrams TID, and then I'm going to recheck it in a month. And I also, this is a good topic to bring up, but the endothelial glycocalyx, it's kind of become part of our medical vernacular. And
Sure.
Endocalyx Pro and Arteriosil are the two products I know of that are supposed to work on it. It's supposed to do a good job. But talk to us a little bit about that. And also, I know I'm throwing a lot at you, venous leakage.
Sure. Well, when it comes to endothelial inflammation and ED, it's obviously it's a problem. But our device is new. We have, and as I told you earlier, we have the largest database now of erections in the world, tens of thousands of erections, and we would like to work with integrated practitioners. And we just started working with the the Medical Health Institute in Miami. I don't want to endorse anyone. There are a few practices that are now incorporating our technology in their overall evaluation of the patient. So, because we don't really know how these markers correlate in this case specifically with erectile dysfunction or even erectile fitness,
Right.
because we're all on a road from fitness to dysfunction. We
Right.
all would like to know, make a U-turn if possible,
Yeah.
or at least hit the brakes. But we don't know where we are. We don't, because we don't have a dashboard. So what we're providing is data that is actually a dashboard about the end organ, not about a marker inflammation. Because when your inflammatory markers are high, they don't tell you where in your body they're high. They just tell you that
Right.
there's inflammation. And of course, we make an assumption that there's inflammation in our heart because we all develop heart disease as we get older. So when it comes to venous leak, so again, I wish I could be more specific about these markers, as we discussed earlier. If you can introduce me to someone who wants to start to correlate our database with these markers, that's the future. That's going to happen over the next 3 to 5 years, and I'm really, really, excited about correlating those things, because men want to, with 50% of the adult population age 50 having ED, and it being 70% by my age, we want to know. I want to do more than just chase markers with. And I do, by the way. If you went to my bathroom right now, you'd see 8 things, supplements that I'm taking. I am chasing a few markers, but I want to chase end organ disease as well too. And that's what's exciting about the CT angiogram, and also exciting about what we're doing, because now we're looking at the end organ, the heart and the penis that we want to have an impact
Yeah.
on.
Remind me, I
When it
have
comes to,
a MD in Miami who has 3 other MDs working at his clinic, and one is a cardiologist, and they do really cutting edge stuff. Had him on the podcast, and his wife's a biological dentist right across the hall. And so you guys could also discuss the role of sleep disordered breathing, since that impacts everything, and erectile dysfunction.
well, let me talk about venous leak and sleep, and then and offline, you and I should talk after this, because I was really excited about our conversation earlier.
Yeah,
Um,
for
in terms
sure.
of working with really looking at these markers. So venous leak. So there's venous leak that people are born with, meaning that the sphincters in the veins that hold blood in the penis they're born damaged, and men discover that they have venous. These younger men discover they have venous leak because they masturbate when they're teenagers, and they can't stay in an erection. I'm not talking about that group. I'm talking about what happens to everyone as we get older. Every erection ends with venous leak, so to speak, because the veins open up and the blood comes out of the penis. So as we get older, the smooth muscle around our venules gets weak, and our vessels get stiffer, and therefore it's harder for us to hold blood in the penis. To draw an analogy, I'm 71 years old. If I sit on, and I'm in pretty good health, maybe not as good as you are, but I'm fairly good health.
Yeah.
If I sit on a plane for 5, 6, 7 hours, an international flight, my socks get a little bit tight. My rings might get tight especially if my arm is dangling. Why? That didn't happen to me when I was 25 or 35 years old, because my smooth muscles have gotten older, and we can't exercise our smooth muscle in the gym. You can't make these smooth muscles get stronger, because in the gym you can work out the skeletal muscle. So in the area of erectile dysfunction, there's a lot of emphasis on pelvic floor strength, and that's important. but it's not critical because it doesn't put more blood in the penis. It just, in order to put more blood in the penis, you need to have good arterial flow, and you need to then hold the blood in the penis. So the PD5 medications, the Viagra, the Cialis, they put more blood in the penis, but they don't keep it there all that well, even though the pharma companies would like to make that claim. In order to keep blood in the penis, you need a mechanical solution. And I didn't understand this myself because I don't technically have ED, although I do have venous leak. I mean, I technically have ED in that, okay, I have sex every day, but I don't, I lose an erection faster at age 71 than I did at age 13 or 20 or 30 or 45 or 50. So you need a ring is a mechanical solution for that. So we did a study, and there's an independent study that's going to be presented at the Society of Sexual Medicine show in October. I was interested in researching detumescence because detumescence is the time it takes for an erection to go down after climax. Because the more blood that's held in the penis, the longer the erection, man will stay hard. And I wasn't interested in this from the perspective of men with premature ejaculation, especially young guys who want to stay hard after they come because they want to satisfy the partner. I just want to know what's holding blood in the penis more. A PD, specifically looked at tadalafil 10 milligrams versus our maximum performance ring. So we studied this on 15 men. There's a bigger study coming out with 25 men with nothing. And these men were just masturbating because we want to get rid of all the variables, just masturbating, no marijuana, no alcohol, masturbate. The erection went down top of my head in like 25 to 30 seconds. With tadalafil 10 milligrams, which is the most common drug taken for ED in the United States, with 10 milligrams of tadalafil, it was 20 minutes. No, excuse me, a little bit over 2 minutes. With our ring, that's a performance ring, it was a little bit over 4 minutes. And with both the tadalafil and the ring together, it was a little bit over 5 minutes. So the takeaway for men is put a ring on it. You know, if you have ED or you're losing erection, you get erections and you lose them. The first solution should be put a ring on it, and then add a pill to maximize your performance. And that's not the way urologists, sexologists are currently thinking, because they're not thinking about rings as a mechanical solution to the venous leak that we all get, and they should be thinking about it. So. Again, you know, the takeaway is put a ring on it for health data and put a ring on it to maximize your performance.
So I'm sure there are a lot of guys who are going to listen to this and say, how do I introduce this to my partner? How do I explain this to my partner without it just seeming bizarre?
Well, let's look at vibrators for a moment, okay? So, and they've gone mainstream in my lifetime. Tim, if you don't mind my asking, how old are you?
I'm about to turn 43.
Congratulations. You're a young man. Before you were born, my mother's vibrator was stashed away in the bottom drawer of a dresser in a supply closet. In 1970s, 1980s, vibrators began to become popular, but there was a certain shame associated with them for women. Oh, you have to come with it through penetrative sex. You have to come without a vibrator. That's totally gone. Vibrators have been mainstream. I don't know how many vibrators my wife owns. And our daughter, who's 29, takes them on dates. And that's normal. There's virtually no shame for women associated with a vibrator. And I still don't care. Whatever makes my wife happiest, I'm down for it. Just, I expect reciprocity, of course. But that transformation has happened with vibrators. For men, there's still this, especially with straight men, there's still sort of shame or embarrassment associated with cock rings, and that needs to change. That's just the mindset. So men need to this should be something that men see as a crutch or an aid. They need to see this as an enhancer for both parties, and that's how it should be introduced to my mind. This is going to be better for both of us. I'm going to be more confident. You don't have to stress about whether I'm going to lose my erection. We can make love for longer. I think that's a winning argument for most women. And the great thing about our rings is that they don't have to interrupt sex to put it on. You can put on a man's flaccid. So you can put on with discretion if desired. But it's certainly for a turn on for a guy to have his wife or his girlfriend pop a ring on him, or his boyfriend.
Yeah. That's awesome. And so how long has the company been in business?
Sure. We hard launched, so to speak, at the Consumer Electronics Show in January 23. And since then, we've sold about 13,000 products, about 2,500 of the rings with the technology and the rest without the technology. There are
Okay.
4 papers that have been presented, academic papers that have been presented in accepted publication, demonstrating its safety, its superiority to the subjective questionnaires that are used, the SHIM and the IAT. Um, there's research going on right now about how to use the device to monitor testosterone therapy. We're about to kick off a paper? Does Botox work? To increase penile blood flow. There is proposed research to evaluate about how to use the device to evaluate antihypertensives and antidepressants for sexual health.
Awesome. Well, and how has it been received overall, both in the allopathic community and more open-minded integrative community?
Well, people don't know about it, because we don't have a large advertising budget. So our focus has been on getting research published, or my getting for PR purposes, or being on podcasts. So frankly, about more than half my business comes from my speaking to people like you, largely in the integrative world, or the sex positive world about the device, and there it's been really well received.
Do you think it's something that we will see in adult films in the future?
Well, that's a whole other aspect to it, and I'm certain you will. And by the way, it costs to have a name, all OnlyFans star do this costs more money than we have. I put this way: I'd rather spend the money on research at this point, because those stars want $50,000, $100,000, maybe even more, just to show it. But this will lead to gamification of sex. This not only will this technology transform urology and sexology, but it'll be on people's dating sites. Hey, that guy makes 7 figures and drives a Porsche and is good looking, but does his dick work? We've even had conversations with doctors in the Persian Gulf or in India where they're arranged marriages, where they see this device being used to prove that, hey, if I'm gonna have my daughter married to this older rich guy, but they want children, can he perform? Prove it.
Right.
And we have gay guys who are using it competitively. That I'm aware of. The only people I know who are using it competitively so far are gay guys on the weekend to compete with their friends who's hardest the longest over the weekend. Ultimately, of course, this can answer important questions like who's harder, the Chinese or the Japanese, the Americans or the Russians, or
Right.
which football team, basketball team is the hardest.
Right. Absolutely. And the allopathic community, urologists, um, cardiologists, are they open to it in general?
They're open to it, but that community is driven by the CPT codes.
Yeah.
So we have FDA registration. We don't have FDA approval, which you need in order to get a CPT code. We applied for it because we now have enough research to justify it. But our government doesn't move very fast, so that process will cost money and probably take about 2 years. But
Yeah.
I'm confident that what we're doing will become a standard of care, because as you and I discussed earlier, you don't take care of someone with blood pressure without a blood pressure cuff. You don't take care of someone with heart arrhythmia without electrocardiogram. And you don't take care of someone with kidney disease without getting their renal function blood test. So we need, aside from the impact of this on cardiovascular care, urologists, how can in the future, people will not be able to treat sexual function without a data-driven device?
Absolutely. And where do you see the future of collaboration between your company and other healthcare providers? Where do you see that going?
Yeah, well, we have some wholesale relationships there are urologists who aren't just thinking conventionally. So there are some urology practices. I just spoke with one before you, who are interested in utilizing this, uh, even though there's no CPT charge for it, because they recognize that they should not be delivering care to patients that's not data driven. If you can put someone on testosterone, find out what the baseline is, and then you measure the impact. If you're going to be putting someone on a PD5 medication and they do have side effects, get a baseline and then monitor them. So we have relationships with about a half dozen urology clinics. There are 5 hospitals that are utilizing this device before and after prostate surgery, for example, in order to establish a baseline. And there are several integrated practitioners who are utilizing it similarly. They want to know what works and they want to be able to monitor it.
Is there or are there any supplements, nutraceuticals, so to speak, that can help this venous leak syndrome or venous leakage syndrome?
We haven't found any. And we test, we test products here. We've probably tested certainly over 10 products here. There are a lot of things that this is true with allopathic medicine as well too. There are a lot of things that hypothetically should work. They should work, but they don't work. and so you have to say, well, so there is one product that's going to be a paper presented at SSMNA. It involves 3 substances that did produce more nocturnal blood flow. And I have an NDA with them, so I can't tell you the name of it because I know he wants to publicize it after the paper is presented. But it's a combination of 3 commonly used products. And off the top of my head, I know one's nitric oxide, one's L-citrulline. I don't recall what the third one is. And so I think if people are taking, well, again, and I suspect there's tremendous individual variability as well too. So if people are taking supplements, whether it's nitric oxide or L-arginine or L-citrulline or maca root, you can utilize our device to learn what works for you. And you look at someone like Brian Johnson, the guy's taking 181 supplements. I don't think he's benefiting from 181 supplements. He might be benefiting from only 5 to 6 of those. There's no reason, from my perspective, to choke down fistfuls of pills every day because they might benefit when you have something that can tell you whether they will benefit. So if men want to know if men want to know what their sexual health status is right now, or if they have ED and they want it before you spend hundreds of dollars on supplements or testosterone or PD5 medications, why not get it? From my perspective, and I don't say it's just because I want to make money, because this is what I would do. Be like, if I want to know what's going on with my blood pressure, I wouldn't just take pills. If I wanted to know what's going on with my cardiac vessels, I would just say, hey, I'm just going to take a beta blocker and some nitric and some niacin. I want to know what's established based on what's going on. So, and sometimes placebo effect's powerful. I mean, there's a guy in town here who swears by beetroot. Well, we tested his beetroot product on 6 men, and none of us, had any differences. He still swears by it.
Right.
Okay. The placebo effect is powerful. I mean, I prescribe Cialis to people. I've got guys that tell me it works if it's just in their wallet. Well, that's placebo effect. It's powerful. And I suspect this guy's getting his beetroot is just doing the same thing, for him. I don't think he actually wants to know his data because he doesn't want to know objectively what's going on. Anyway,
Yeah.
Tim, you and I want to be in the objective world as much as possible.
Right. Absolutely. Yeah. And I think now, like to your point with Brian Johnson, I mean, a lot of that money I think would be better spent on testing and quantification. I know he does some of that, but I can't think of 180 supplements that I would want to take. I mean, number one, that's going to compromise my renal function at some point, right? When you cross over like 50 or maybe even 40. I take about 7 or 8 supplements. I'm the type of person, I don't mind having extra bottles, but I want to be able to titrate the dose of, say, thiamine, relative to B9 or folinic acid. But the point being, I don't have 180 bottles, but I think, quantification, I measure my homocysteine, make sure that's around 7, because I have MTHFR, and that obviously plays a role in cardiovascular health. But yeah, I think the work that you're doing is amazing, and it needs to be talked about more. Should we expect to see you at one of these adult film conferences in Vegas.
Well, we went to AVN and it wasn't that great a show for us. I mean, the good shows for us are the sexologist shows. So the European Society of Sexual Medicine, the Society of Sexual Medicine North America, the doctors and the sexologists who are interested in who are really interested in data-driven care are the ones that are most interested in what we're doing. The AVN, the sex toy shows, we just get lost in a forest of products, and the sex toy sector is interested in, it's really actually most interested in women. And
Yeah.
we are developing a product to measure clitoral health that we hope to bring out next year. But
Right.
it's not, you can get cheap cock rings for for $10-15 at any sex toy show in the United States. Ours is the only cock ring that can be worn for a prolonged period of time and is safe. But the sex toy shows, they're interested in moving inexpensive quantity of a product.
Right. Awesome. Well, what's one thing you know today that you wish you would have known 10 years ago?
Whew, I immediately will start thinking about politics and science. I say, my distrust of the FDA and the CDC is profound. And back 10 years ago, it was like a mild skepticism. But I wish I'd known 10 years ago about the importance of nocturnal erections and had some way of monitoring them, because I'm 71 years old and I want to enjoy a lifetime of lovemaking. I'd like to make love next 10, 15 years.
Absolutely.
And I wasn't thinking about it then, and I am, and obviously right now I'm really focused on it.
Wait, you mean the CDC is not an objective third-party
Shocking.
organization? My mind is blown. It's going to take me a while
Yeah.
to process. No, I'm kidding.
It's a good thing that you're sitting down. I see you got yourself strapped in with a shoulder harness there.
Yeah, I do. I'm just blown away. I'm amazed, which is 10 levels past the maze. So well, we appreciate you, Dr. Justin. Keep up the great work, and we'll put up all your website links and social media links, and we'll invite you to collaborate.
Yeah, you can find me at myfirmtech.com or Elliot at myfirmtech.com. And I look forward to collaborating. And thanks so much for having me on the show.
Awesome. Thank you so much.